Did you know that approximately 3.5 million youth between the ages of 18 and 25 experience homelessness each year here in the United States? And out of those 3.5 million, nearly 69% of that population struggles with mental health issues. This is why our federal government must prioritize funding for community-based mental health programs that help young adults experiencing homelessness. The current system heavily focuses on temporary housing, which is very important. However, without addressing the mental health issues that these individuals are going through, it just leads to a recurring cycle of homelessness. According to youth.gov, about 46% of those homeless individuals identify as the LGBTQ community. This population unfortunately suffers heavily from depression, anxiety, and often come from hurtful family dynamics that lead them to either running away from home or being kicked out of home. By urging the federal government to prioritize funding for these community-based programs, we would be helping communities have access to much needed resources such as outpatient clinics, peer support groups, mobile crisis teams, and this would all be to help young adults that may be going through a crisis. According to the World Health Organization, these programs usually have a much better success rate than institutionalization, which are usually associated with poor living conditions. By emphasizing recovery within a community setting, these programs encourage long-term stability and reduce the likelihood of repeated homelessness. The U.S. Department of Health and Human Services even backed this information and released statistics that emphasize the importance of mental health within the homeless youth community. Studies show that nearly 69% of homeless youth report conditions such as anxiety, depression, suicidal ideations, and more severe disorders like schizophrenia or bipolar disorder. This is important because these issues usually arise within adolescent years. Programs like the Coordinated Specialty Care, or the CSC, provide team-based treatments that include psychologists, social workers, and vocational specialists. Evidence from the National Institute of Mental Health demonstrate that initiatives such as recovery after the initial schizophrenia episode significantly improve outcomes, including increased participation in work and school, and better overall quality of life. These findings highlight the importance of addressing the mental health issue early before they escalate onto long-term barriers. One of the great programs that we have available here in Buffalo is the National Alliance of Mental Illness. This program offers things like psychological rehabilitation, employment assistance, crisis intervention, and peer support services. These resources are so important because they assist individuals to create skills that are so necessary to generate independence amongst themselves. Things like maintaining employment, continuing education, and managing their mental health. There are other national programs that are such a great resource for individuals that are going through crisis, such as the National Runaway Safe Line, which provides crisis intervention, referrals, and support services through either phone, text, or online, which makes it very accessible for so many people. These resources are critical for youth going through crisis, yet they cannot fully address the long-term needs without additional investment in mental health care infrastructure. Expanding funding for programs like these would increase the accessibility and provide more comprehensive support for vulnerable populations. Additionally, Housing First programs usually face long wait lists due to limited accessibility. According to the Center of Budget and Policy Priorities, many housing assistance programs have multi-year wait lists due to high demand and insufficient funding. So rather than replacing Housing First entirely, policymakers should integrate it with mandatory, accessible mental health services. By combining immediate housing with consistent mental health care, individuals will be more likely to achieve long-term stability. There are already so many wonderful organizations supporting at-risk youth, but they remain underfunded and underutilized. Ultimately, addressing youth homelessness requires a shift in priorities. While housing remains an undeniable essential component, it can't stand alone as a solution. And that is why our federal government must prioritize mental health funding in order to assist youth at risk of homelessness here in the United States.